Hi everyone, thanks very much to the team at New College Durham. It's really helpful to see their insight and their story and how they've set up their T-level health suite. My name's Dan, I'm part of the sales team here at Sim & Skills. Personally, I've gone out and helped a massive number of colleges set up their own equipment and get everything ready for, trying to get that realism and everything within their sim centres as well. At Sim & Skills, we've helped over 200 colleges set up their own sim centres. And so what we're going to do today is go through some of the essential equipment that we think is really necessary for helping to, like we say, get that clinical realism for your students to really get involved in any simulation that you're running. So whether that be you're starting a brand new simulation center or you're expanding and future-proofing to teach more pathways in the future, increase your cohort numbers, that's what we're going to go through today. Perfect. So some of the sim center essentials which we're going to go through and discuss now is starting with this hospital bed. So this is a real clinical bed that is motorized, so you can sit the patient up, get them in the right positions for if you're doing bed baths, anything like that, any clinical scenario which you're getting hands-on. This will help with manual handling. So we also have the bed suite, which includes the bed, also with one of these tables, and it comes with a bedside table as well. So you have the full realistic view. We can also have the curtains around each ward, around each bay in the ward, so that we can go through and really get that really realistic clinical feel so your students feel like they are fully immersed in that clinical environment. We also have the head walls. These can be functioning and non-functioning, meaning that we have a compressor which allows air to run through it. So if you're going through scenarios that include suctioning, medical air, anything like that, we can provide all of that, and you can go through and really provide that really high fidelity simulation as well. We also have drip stands with infusion bags. So if you are going to have any sort of line, saline, blood, whatever it is, you can go through and do that as well. So we also include patient monitors as well, which include things like heart rate, body temperature, respiration rate, blood oxygen, everything that you would need for your students to take the sort of baseline observations that they'll be going through. Crash carts as well, including drugs, so they can look at stock management and go through everything that's included within that as well. Also, so when we do go through now, we do have things like wheelchairs, commodes, walking sticks, walking frames, everything. So when you are going through any manual handling training, teaching your students on how to do the correct manual handling procedures so they don't hurt themselves or the patient in the bed, we can go through, and it's really easy with this equipment to go through and teach that process so that when they do go out into their clinical placements, they completely understand and they're already immersed in that environment. So moving on as well, if you are looking for any audio-visual recording equipment for any sort of ESP type scenario where you're recording what your students are doing, we can provide both fixed and mobile solutions. So whether you want to have cameras over each bay or you want to just have some cameras that you can move into different areas within your sim suite, that's absolutely fine as well. And so what we can do is just provide lots of support and guidance from us as well. So if there is anything that you need a little bit of advice on that you're not quite sure about, please just give us a call. You can sit down with one of our team and we'll go through absolutely everything with you. One of the last things I want to talk about in terms of this equipment here is some of the considerations that you need to think about when providing this kind of equipment into your sim center. So what if you're looking at is where your simulation center is going to be based. For example, if it's a couple of floors up, do you have a lift to get these beds in? Will it fit through the door? Things like that. We just need to have that conversation. So again, please just give us a call and we can walk you through those steps of how these beds come. Installation can be done by us as well. So if you do need that, that's absolutely fine. Or if you wish to do that yourself with your team at your institution, that's absolutely fine. No worries. Perfect. So one of the main things that we need to teach our students while they're going through this process of the T-levels is we need to teach them about patient-centered care as well as communication and all the other really important aspects. But like I say, all of that sort of comes under the umbrella of patient-centered care, which is what we think Juno is perfect for. So Juno is a nursing skills mannequin and is our recommended mannequin for T-levels and is one of the most popular mannequins out there. So what I'm going to do is I'm just going to go through a little bit of a head to toe on some of the main features that you guys will use Juno for, and that can really help your students progress through their learning and help them get ready to go out into the clinical environment so that they're not shocked and that they're fully ready for that clinical environment. So what we're going to do is, first of all, is Juno can be bed bathed, so you can go through and practice Juno in lots of different positions because Juno can articulate arms and legs. And also using this bed that we currently have, we're able to get Juno into lots of different positions so that we can go through and really look at those different positions. Looking at that manual handling, we can go through and sit Juno up, sit Juno at the edge of the bed, at the end of the bed, and all while we're doing that we can practice safe and proper manual handling techniques to make sure that the patient is safe and that also your students are safe when they go out into clinical placement as well. So what we can do is we can go through eye irrigation. So we've got optical care, so you can go through and irrigate the eyes to make sure that they're nice and clean. We can go through oral care. So what we can do is you can get toothbrush, water, whatever it is, and you can go through washing the patient's teeth. You can look at denture care by taking out the lower set of Juno's teeth. You can take them out, clean them, pop them back in, all whilst practicing the patient-centered part of it, while talking to the mannequin, talking to Juno, talking to your patient. And so what we can also do is we can look at our physiological measurements. So when we're going through, we can take our manual blood pressure, which your students can practice over and over and over again to make sure that they're right. So Juno comes with their own sphygmometer, which you can pop onto Juno, and they, like I say, can practice that technique as much as they can. We can also, when your students are learning about the News 2 process, what they can do is they can go through and take all of those physiological measurements with Juno, with Juno's patient monitor, so they can look at blood pressure, they can look at our heart rate, rest rate, body temperature, everything like that. They can go through and look at that to produce a full News 2 score as well. So I have spoken about articulating arms and limbs, and so what we can do as well is Juno has a realistic weight as well. So when we're going through all of that, Juno's torso with legs and everything weighs about 23 kilos. So it's be a good indication of how they're going to be able to sit the patient up and go through all of that as well. And then so Juno is also male and female, so it comes with a male and female chest skin, and then it also comes with male and female genitalia as well, so they can really go through and practice lots of different scenarios as well. We also provide hyper realistic face masks for Juno as well, so if you want Juno to be elderly, to look slightly more unwell, to look paler, we can do all of that as well, so that they don't look too healthy while your students are going out, so they're not shocked once again when they go into that clinical environment. When we're talking about Juno as a mannequin as well, what we can hear is, you might be able to hear on my microphone, but Juno's actually breathing as well, so you have those breath sounds as well. So not only can you look at, when we're doing those physiological measurements at the patient monitor, you can also count the breathing rate, you can take a pulse rate, so you can do that so your students learn different ways to do it and not always to rely on the medical equipment as well. And so we also have heart sounds, lung sounds and bowel sounds, so if you do wish to auscultate, you can hear that as well. And then so going through to the final part of skin integrity with things at Juno, what you can do is you can practice the care around different types of skin integrities. So if you've got bed sores, pressure sores, erythema, any type of skin integrity issue, what we do is we have these sticky wounds. So we have a really wide variety. So we have things like pitting edema, cuts, sores, bed sores, burns, anything like that. We can go through, pop these straight onto Juno's skin, and they will stick like that for us. And so then you can go around through the different stages of care, whether they be doing the actual treatment or whether it's just looking at the care around these different skin integrity issues. We can go through every step of the way whilst doing our communication, talking to Juno, talking to our team around us. So not only is it looking at that focus, we can also look at teamwork whilst also keeping Juno right at the centre of that care as well. Great, and so the last thing that we're going to cover today is about communication. So we know over the last few years, students have really dropped marks when it comes down to talking and listening to the patient, because When they're going through their assessments, they're so focused on the single task at hand that they forget that there's the rest of the patient that's lying in the bed that they need to talk to whilst they're out on clinical placement. And so what they've been doing is just going through, for example, physiological measurements, taking that blood pressure. And so what they need to do is have the constant practice all throughout the year of talking to the patient and communicating with them for things such as consent, capacity, making sure that they're okay, if they have any allergies, whatever it is, whilst they're going through all of those assessments. And so what we found is a piece of generative AI communication software which can be used all day, every day with the mannequin, no matter what mannequin it is that you have, so that they can practice that on a daily basis. And go through all of those different scenarios. So what I'm going to do is just do a really quick sort of brief demonstration of it. And if you have any questions, please just let us know afterwards. Good morning, how are you today?
I'm feeling a bit worried about my confusion, but I'm hoping it gets better with time.
Okay, well my name's Dan, it's really nice to meet you.
Nice to meet you too, Dan.
Can you tell me your full name and date of birth?
My full name is Daniel Owen, and my date of birth is April 11th, 1957.
Thank you. And so can you tell me a little bit more about this confusion that you're having?
I've been getting a bit confused lately, especially in the evening when I'm tired. It's like I can't quite remember things anymore.
And how long has this been going on for?
I don't know exactly when it started, but it's been getting worse over the past 3 to 4 days.
Perfect. So that's just a brief scenario. That's one that we wrote just a minute ago about a patient that obviously has confusion, that we're maybe sort of querying dementia or something like that. And so this product is called Simvox. And so, like I said before, if anyone has any questions about that, please let me know. But also, so when you're creating these patients, what we've had some people do is they've put in past papers about ESPs, or they've created any of their own scenarios that they want to, so that they can really focus on specific things. So whether that be introducing yourself to the patient, making sure that they're taking their full name, date of birth, IDing the patient, and then just really checking for that consent and the capacity and things like that. Okay. Well, thank you very much for joining the webinar today and listening to me go through some of the equipment that we think is perfect for starting or expanding your simulation centres. Thank you again to the team at New College Durham for going through their story of how they set up their T-level site. And then, so we do have a product guide specifically for T-levels. There'll be a link going into the chat now. And if anyone has any questions, please let me know.